All right, well, welcome everybody. I'll give everyone a minute to settle all in before I introduce our two panelists. And if you do have the chance, if you're able to show your face, that's always helpful because we'll make this as interactive also as possible. We have a bunch of submitted questions as well as if questions come up, just drop those into the chat. Even as someone is talking, just drop those into the chat and we can try and add those to the queue. But a lot of really interesting things to talk about. I'm really excited for this. I'm Jared Vagey. I run the webpage, Climbing Doctor, and we've been hosting these events about 4 per year, going through just special topics of interest with medical providers and rock climbing. And so I'm really excited to introduce Zack and James. And the topic is national team traveling physical therapists or physiotherapists. And each of them have a wealth of experience traveling with the teams that they're going to share with you and go over all the different questions that you have. And I'm excited to learn from this as well. So I think what we'll do, I'll have both Zack and James intro themselves, and maybe Zack, if you want to get started, if you want to kind of do a brief intro, James will do one as well. And then I'll just start. I'm just going to moderate and start asking some of the questions as we go. But Zack, go ahead and intro.
Sure. So my name is Zack DiCristino. I'm the USA Climbing National Team Physical Therapist and Medical Manager. I've been practicing PT for about 22 years now, climbing for a little bit longer, about 20, maybe 23. And I'm now based out of Salt Lake City, which is the headquarters and where our national training center is.
And James?
Yeah, my name is James Walker. I'm a physiotherapist and I've been practicing since 2009. And I'm the team physiotherapist for the GB climbing team. My role is quite different to Zack's in the sense that USA Climbing have a full-time physical therapist who work with them, whereas I am just at the moment just going to the major events. For example, the European Championships that's just been on, and also the World Championships last year. But I'm based in Sheffield in England, and that's where pretty much all of the GB climbing team live. So I kind of work with them outside of the major competitions.
So we had a ton of questions and some really interesting ones, and I think we'll kind of split this into different segments. But I think the first segment is kind of how each of you got involved. I think everyone is interested in that, not only for your story, but also as everyone listening is kind of envisioning themselves kind of going into these roles at some stage or a dream or aspiration for it. How did you kind of make your way into where you are at now? And maybe we'll start with Zack and then go to James.
Sure. I mean, it's a long story, and I'll try to make it somewhat succinct. But I mean, as I said, like I started climbing back in undergrad, so I didn't ever really get into competition climbing at a young age. Where I grew up, it really wasn't known about, but luckily we had an indoor wall where I went to undergrad at UNC Chapel Hill. So I mean, right off the bat, like it was like most of you guys, like you just fell in love with climbing, and it was part of your life. And then as I started practicing PT, I think like maybe just to answer some questions that might be on the list here, is like I started practicing with a group out of Vail, Colorado, and they were a really strong orthopedic world-renowned group. And so luckily I just got really good experience working with elite athletes, from the Olympic level to the recreational level, had some really great mentors along the way. And then from there, luckily, me and another colleague, we were the only climbers on our PT staff. And at the time, USA Climbing was based out of Boulder, Colorado. And so we realized that in its sort of the organization's infancy, they didn't have any kind of medical support. So we approached them and came up with sort of a partnership, if you will, that we would be their official medical providers. And it started really small, where we would just cover sort of the World Cup that was in Vail at the time for many years. We would help cover the team, and then we'd also travel with the team to either the Youth World Championships or the Adult World Championships. So we didn't really cover many events at all, but we were there for those who could make it to us to Vail if they needed consultations and treatment. So, and then from there, it kind of really grown mostly because of the inclusion in the Olympics, and that's probably another topic we can talk about later, but how that happened. But because of that, there became a lot more support, as you can imagine, from the financial side, and that's why my position is part of the reason is like I'm full time with USA Climbing and a staff employee, and now I travel pretty much to all the World Cups with them and all the competitions. So.
Yeah, and James, how did you get involved with Great Britain Climbing?
Am I on? Yeah, okay. Yeah, so similar start to Zack in the sense of I started climbing personally myself when I came to university in Sheffield in 2006. It's pretty much the hub of UK climbing, really. It's lots and lots of climbers in the city. It's close to the Peak District National Park, which is a lot of outdoor climbing. So yeah, I started getting interested in climbing myself when I was at university. And then, yeah, I moved back to Sheffield around about 6 years ago. I kind of did some traveling and a few other things and worked in a few different places. But yeah, I got back to Sheffield around 6 years ago. And that was when I kind of really got interested in treating lots of climbers. And over more recent years, I've kind of specialized more and more in that, and just started working with a lot of the GB team kind of privately. And what I mean by that is, as Zack was saying, basically funding is always the issue with this sort of stuff in terms of before the Olympics, it was pretty much in the UK anyway, the only people who got any sort of funding was the top, really, which was, I guess, basically Shauna Coxey. She would have funding for this sort of stuff. Obviously, she went to the Olympics, but no one else in the GB team would have that. But because of the Olympics and more funding from what we call UK sport and GB sport, that has meant that they can start to fund physiotherapists working with the team, and that's hence why I go to some of the events. But yeah, I think I was just speaking with Zack before everyone came in, but it's extremely different per nation in terms of, for example, I don't know, Zack, there's how many teams have their own physios who are with them all the time? Like the French have one, don't they? The Germans, the Swiss, but there's a lot of teams that don't have any support.
Yeah, the Austrians, I would say probably, like I say most teams now do, but what you'll sometimes see occasionally, you won't see a physio accompany a team and always ask, oh, where's so-and-so, as we've gotten to know each other. And it's always, unfortunately, well, I mean, you're always going to put the athletes first. And so if the funding is there, it's the opportunity to send another athlete to get the experience, maybe like, a lower tier athlete. And so sometimes that's what happens, but I would say what I've heard, like you don't see many from the South American teams as much. And what I've heard, at least several years ago, is physiotherapy, physical therapy is not viewed at the same level it is in our countries, which, I mean, kudos to our federation, our organizations and associations that have really pushed the profession. And I think down there, it's just not viewed as valuable, which is unfortunate. So, but slowly, I think, like I see teams like Brazil will occasionally bring someone, but some of the other teams like, Venezuela or, some of the other South American teams, you don't see that support, unfortunately.
So yeah, I'd been working with the sort of GB climbers themselves for quite a few years, but it was actually only last year at the World Champs in Moscow was the first time I'd actually gone with the team, because like, yeah, it's very unique per country of the actual funding. So GB climbing do not have funding for like a physiotherapist at every World Cup event. So they only currently have funding for the major championships. So yeah, for example, I was just in Munich, just got back this morning actually from Munich. And that's it at the moment. But going forward, that will change and they'll start to get funding depending on Olympics. But yeah, so that's my current involvement.
So I have a question then for Zack, and then one targeted towards James. And I guess for Zack, looking at kind of like you're fully employed with USA Climbing. So what does your day-to-day look like, on a typical day? And I know a typical day is in quotes because you may be in, overseas with the team. You may be managing components, but what does a day look like for you? And then on the flip side with James, maybe what does a competition day kind of look like for you? So we can kind of hit both of those aspects of painting the picture of what it looks like. Yeah. So Zack, I guess to the best of your ability, what does a day in the life of Zack look like?
So usually like so if we're home and we have now a pretty good amount of people who have been living here in Salt Lake City that are on our national team, and we've heard like 16 more people are moving here because of the training center and go to the university here. But so like what we usually do is we have 2-a-day sessions at the training center. So one like kind of late morning to early afternoon, and then late afternoon to evening, depending on what the coach has planned for them. And not that the athletes go to both sessions every time. Sometimes they'll go to one and they just do one session a day. But a good portion of them do like a lot of off the wall conditioning with me, or, obviously like any kind of treatment that might be needed. So what it looks like for me, usually like my day usually starts, maybe like 8 or 9, and that's mostly the medical manager side. I'm usually catching up on emails and not to bore you too much, but what I do on that side is we work with our medical committee and we tackle topics about various like hot topics within the sport, mostly about athlete wellness, mental health, eating disorders, disordered eating, injury surveillance research. And then also when we are preparing to host an event, like USA Climbing's hosting like a youth national championships or our own national championships, like I'm involved in providing the medical coverage and making sure we have the medical supplies for those events. And when COVID hit, that was a huge part of it, because we had to come up with protocols and how we could safely have these competitions and not have a what they would call a super outbreak, super spreader event. So that was the majority of my work back then. But then as the sessions get started, it's kind of funny. It's like really basic. Like I have this little sort of dry eraser board, and the athletes just sign up for treatments. And I would say the majority, luckily, but the majority are more maintenance kind of, like a lot of hands-on manual treatments. Like here we can do dry needling in Utah. So it's a lot of more to keep them performing well and feeling well. And then within that, obviously, if we have injuries, they're kind of, I won't say prioritized, but we make sure we get them in several times a week, or I get them in. And so the session, usually the athletes, they come in, they warm up, they might check in with me if they have some kind of little niggle or something like that. And then afterwards, it's when I'm really busy, the tail end of the session, because then they're kind of all beat up and tired, and especially if they're 2 days on in training. So, and that's kind of how it is like when the athletes are in the training center. What I'd also do with them is I do a bit of programming. So like I said, like off the wall, some of it's kind of general strength and conditioning stuff, or injury prevention. And then you're also there, I think a lot of people don't realize, is that you're also there if you have obviously the right training, certifications. You're also the first responder. So I'm also there at every training session, because if someone goes down, falls on their head, or sprains an ankle, like I'm the first to react. And I would say maybe hands down, that's one of the biggest assets of having someone at these sessions, because you can immediately come up with a plan and assess them or get them into the right hands pretty quickly, so that you can come up with an action plan sooner than later, versus, you know, the typical path sometimes that takes a couple weeks for them to see someone, and by then, like, they're already kind of behind in their rehabilitation. So that's or it's like it's a minor thing. It's like, oh, you're fine, I think you can continue training. And so that's like a typical day in the training center when we're not traveling.
A lot of moving parts, a lot going
Yeah.
on. And then James, can you speak to traveling? So just like what, you know, when you travel with the team, let's say, you know, kind of break down kind of what Zack did, but a day in the life of James traveling with the team. And then I think after that, I think we'll go through some photos and, you know, so forth, and kind of share some stories. But yeah, James, go through what that looks like.
Yeah, okay. So, yeah, what will happen in terms of traveling with the team is depending on where, so I'll speak about, yeah, my experience, but then just generally as well. So depending on where it is in the world, depending on, as in like time difference and time zones, the team tend to get there a certain amount of days before any competition, because obviously they don't want to turn up super jet lagged, or they don't want to turn up and not be prepared or not knowing where they're going. And I suppose acclimatization would be so sometimes pre-comp, there's a few days where a lot of time they would still climb. They carry on, because what you got to think about is the season's super long, so they're continuing to train and climb throughout this kind of period of time. So sometimes it will be maybe a day at the wall, doing various different things that they want to do, and then yeah, you have your pre-comp days and then comp days. So yeah, in terms of the actual comp day itself, what tends to happen then is you usually have to get there a decent amount of time before the actual competition starts. So if we take Boulder, for example, they have to go into isolation. So an isolation will open at a certain time. There's about an hour where isolation is open that you can turn up, go into isolation, and then the isolation closes. And then what will happen then is you will be in there. So usually it'll be a physiotherapist and coach, and the athletes will then be warming up and getting prepared to actually go and compete. And in that time, from a physiotherapy point of view, you will either be kind of just chatting with them, how's everything going, there's no problems, or they'll be saying something feels sore, something's tight, and you'll be doing some sort of manual work in there. And then pretty much in that period of time, you're waiting for them to go out and compete. Once the last athlete of your kind of nation, I suppose, goes out, then what we would do is we would go out to the front and kind of watch them climb and things like that. And then afterwards, I guess it's all about recovery. So we tend to do a lot of that in the hotels or wherever, so staying in the evenings, and it'll be a lot of like soft tissue work, a lot of assessing, a lot of niggles, things like that. Planning for the next day, what we're going to do, if anything needs taping, if anything needs kind of looking at from that sense. And I guess that kind of cycle kind of repeats depending on what day it is the next day, whether that's a comp day, because the comps are pretty full on. Like Munich, for example, it's like what we've just been in European Championships, it's like Boulder qualification, next day lead qualification, next day Boulder semifinals and finals, the next day lead semifinals and finals. And then if they make combined, it was 2 days rest, then do that all again. So it's real full on in terms of the competitions. I mean, the European champs, the world champs, things like that are probably the events, the ones that I've been to are the events where you do the most kind of amount of volume. Obviously the Boulder World Cups and the Lead World Cups are less volume of climbing, But I think that's pretty much the cycle of what you would do as a physiotherapist when you're actually at the competition. I don't know if that sounds similar to what you would do, Zach.
Yeah, very similar. And I think it's also, unless you have, I mean, there are some teams that travel with like sometimes a couple of physios. Like for instance, like if you're having a competition in Switzerland and Swiss team, you know, it's their home turf, so they can usually bring another physio because it's just easier. But for us that maybe just have one, you're kind of doing a little bit of triage too during these events, and these are long days. Like as James said, like your days start like sometimes at 6 a.m, hoping you get breakfast at the hotel, that they're serving breakfast that early. You go into ISO at 7, and then for me it's very similar. Sometimes I'll just check with the remaining athletes in isolation. Once you get to know the athletes really well, you know which ones you need to stay for, because they'll usually ask for something at the last moment before they go out. But then you'll go out and you'll be available at the wall. So again, kind of more as a first responder, kind of if something happens at the wall, you want to be there. And I would argue that this is where having 2 physios is kind of would be nice, is you have one in ISO and you have one in the wall. But in this case, you have to, you know, choose the lesser of 2 evils, I guess. But then when, let's say if your athletes make it to the next round, so like a typical like bouldering competition would be qualifications day 1. And that can run from 7 a.m. till, gosh, like sometimes 6 p.m. And then if your athletes make the semifinals the next day, your day starts pretty similar. And then if you're lucky enough, your athletes make the finals usually happens that evening. So you have maybe a 2 to 3 hour gap in there. And usually what I'll do is those athletes who are going on to the next round, you know, we'll check in with them, make sure they get the treatment they need. And then as long as, you know, the other athletes aren't injured, you're managing them as well if they need anything. Because those, if you make finals, you're probably not getting done till about 11 o'clock at night, because they have award ceremonies. And then I don't know about James, but sometimes you're living off like pretzels at the venue because that's all they serve, and the restaurants close before you can you know, get done. So
yeah, I imagine you've probably got the hardest job on the circuit, Zach, because all of your athletes are in finals every single week. So,
well,
all day, every day.
Well, we always joke, you know, we always have the saying, it's like, well, it's good to be working late, you know. It's a good thing if you're working late.
All right, so James, I have some photos. I believe these are from Euro champs and world champs. Is that correct?
Yeah, that's right. Yeah, a couple of these are from yeah, so I guess these I've given some perspectives of. So basically when you are when you have your accreditation, so basically when you start any sort of championship or event, you'll go and get an accreditation and you can go into certain places, but you can basically go anywhere. So you can be right at the front of the stage, you can be in the coaches area where the cameras are, you know, whatever. So yeah, I guess these are a couple of photos of just a perspective of like where we are. So yeah, that first one back there, if you just go back, Jared, yes, that's Toby. He's one of the, he's going to be in Dallas actually. So he's a real good lead climber. He's like 17, so he was yeah, competing. So this is qualification route. So you guys, most of the time the qualifications on live stream. So this was the lead finals in Munich, yeah, just a few days ago. And yeah, this is what I kind of boulder the perspective of where we're sort of stood watching the athletes. That's Hamish on that yellow and black problem there in the middle. Yeah, so it gives you a little bit of perspective of kind of what you're doing. I say when you go out of isolation, this is where you will kind of be. You'll be viewing and you'll be sat with the coaches. This is me and the rest of the GB team. These are the other coaches. This is when we were in Moscow for the World Champs last year. And yeah, and again, this was the World Championships in Moscow last year. And you can see the size of it, depending on the event. There's obviously 4 qualification routes here for lead, because And that was real long days, wasn't it, Zach, in for the world champs, because the amount of, I mean, how many athletes are there at world champs? It's like 100 males and females or more, something like that.
Oh yeah, I mean, at
So,
least
so many more than that. So to
yeah,
get through qualifications, yeah, and this is in Moscow as well. This was, I think, maybe semis of the bouldering, from what I can remember. Yeah, so I guess this gives you a little bit of a snapshot of kind of views. And and this is when, yeah, we sometimes win medals, not very often actually, not like the US team, but yeah, this is Hamish when he won bronze in the at the World Champs last year. So that's all the GB team there. So that was pretty cool. Yeah.
And Zach, do you want to share your screen for some photos as well?
sure. I'll do my best not to give you guys motion sickness here. So first, I'll just show you some photos of, on the road, what life is like. So,
Wait,
this might
I don't
be
think we can. I don't think we can see the screen yet. Oh, there we go.
okay. So first, this is kind of medical kit, typical, or at least part of what I travel with. I mean, you can imagine just a lot of the basic stuff. Also within there, like dry needling tools, and you believe it or not, you have to be pretty prepared for a lot of bleeding, and being able to control bleeding pretty quickly during a competition. Sometimes I get a little climbing in, so I bring my shoes, but also, I'm belaying athletes and supporting them that way. So, and then this is what it looks like when you arrive at the airport, and what you're taking usually. This is a little bit more than average. This is from Tokyo 2020, where luckily, I mean, I'm not carrying all this stuff, but I would say probably at least 4 of those bags are mine, including our treatment table. And then our team manager and our coach have their bags of supplies. So within that, we have our recovery tools, we have our medical kit. Interesting story with Japan was for Tokyo, we had to list every single item and piece of tape and how many, pills of ibuprofen you're taking for the Japanese government. So you had to submit all that information because they're pretty strict there, what you can bring and what you can't bring. So, but this is a lot of your time of like airports and baggage checking and all that good stuff, and you're hauling all this stuff around with you.
Zach, I think there's a lag on the share screen because we can just see the only the medical tools.
Oh, okay.
But do you want to do just reshare it one more time for
yeah
unshare the reshare, and if not, I can pull it up as well on my end.
Okay, let me see. I'll try again here. So you guys see?
We got it
what
now.
What do you see now? The bags. Okay. All right. Next thing, I think I'm going to have to go back and forth here, so maybe I won't go through too many pictures here, unless there's a request. So life on the road is also a lot of this. What do you guys see? People sleeping?
Yeah.
So this is jet lag, a lot of jet lag. This is from Tokyo 2020. We're actually on the rooftop of our hotel. And so you can see, we're actually trying to stay up and watch gymnastics, I think. But as you can see, everyone's just crashed out. And so that was another unique experience with the Olympics because of COVID. We had to be in quarantine for 2 weeks, and we could only stay in our hotel, and we could only go to our training facilities, our venues. Otherwise, we couldn't go out. We couldn't go out to eat. We couldn't go to grocery stores. So that was a surreal experience for sure. And then let's see. Maybe just a couple more. Not to rub this in, James, but just so obviously you get hopefully a lot of moments like this. So this is from this year. This is Innsbruck World Cup, where it was bouldering and lead. And so, we obviously did okay there with a few medals. To our right here is Meg Coyne. She's our team manager. Some of you might know Josh Larson, who's the head coach. And then I probably don't need to introduce any of those athletes. Newer to our, I won't say he's new to our team, but certainly in terms of the success of the team, to the left, right next to me is Jesse Grouper. So he's gotten, I think, like maybe 3 medals this year in lead, like a phenomenal, both indoors and outdoors. He's done biography, he's done a lot of 9As. So he's a phenomenal climber for sure. Should I keep going, or are you guys done with the pictures?
Yeah, maybe do two more.
Okay. So let's see. The other thing, obviously, getting to travel with the team is, as you saw from James's pictures, you get to go to, what do you guys see? You see like a climbing wall and cliffs?
Yeah, we can see.
Yeah. So you get to go to a lot of pretty interesting venues, competition venues. This is Seoul, Korea from this year. So it's one of the more interesting venues I've ever been to, from just this mountain park, as they call it, is just in sort of the thick of the city. Like, so what you don't see around this is just, Seoul. It's just like a urban jungle. And this wall is kind of cool that it's kind of like a little old fashioned, I guess, in terms of the panels and everything. But this is this competition, we didn't have a lead competition. We had like a bouldering and speed competition. But that's kind of like the cool thing about traveling, is you get to go to some pretty unique places. So, and maybe one more. And I think obviously, like James and I can agree that, let me see, I didn't pop up. You guys see this one with the guy with the cervical collar, and so,
yeah, we can see.
Yeah, so just having moments like this. This is from our Brixton Bouldering World Cup from this year in Italy. So this is literally the competition ended, but she had asked me to check something out. But she had just won the competition. So yeah, you're kind of in these roles of kind of being on call a lot, which is can be demanding, but you can't complain when you get to do things like this in these kind of settings. So all right,
that was one place we did get a medal, actually. Max won silver.
Yeah.
So I think we have time for probably about 2 more questions. One question came up that I thought was interesting, is talking about coordinating with coaches. I don't know if either one of you wanted to speak with, but as your role as a medical provider, and then you have the coaches as well, how does that relationship work? I don't know if either of you want to speak to that.
Yeah, I could speak a little bit about that. I think maybe from my point of view, I'll let Zack speak about it at competitions. Seems as he's at a lot more of those, and also he's involved. Obviously, he's full time, the coaches and him. But yeah, from my point of view, I think what's the thing that you are needing to do a lot of as a physical therapist is sometimes be the voice of reason, because really the athletes and the coaches, they want to push. The level is so high now, and it just seems to be getting higher and higher, and the juniors that are coming through are just stronger and stronger. And the reality is that climbing is such a strength-based sport, and Zack kind of mentioned it a little bit before, but a few kind of discussions around kind of like weight and eating and certain things like that. And the reality that the reason that those things are an issue or happen is because the level is so high that to be able to get stronger and stronger, you have to push your body in many ways, physically, mentally, things like that. So in terms of the relationship with the coaches, it works different in the UK in terms of most of the GB athletes have their own individual coaches. They're not like coached, I don't know if it's the same in the US, but they're not coached by like one coaching team or anything like that. So you're often between competitions, pre-season, post-season, and also mid-season, you're having to liaise with coaches about, you know, why they need to do certain things, how they can modify their training, how they can manage an injury, because it's absolutely unrealistic for them to have no niggles and injuries during the comp season. It's absolutely brutal. It's just never ending, just like week after week after week of competing. So yeah, in terms of relationship with the coaches, the first thing to say, it's extremely important to have a good relationship with the coaches and also the athletes, because the athletes don't want to stop. They will, any climbers, as any of the people listening to this, working with any climbers don't like not climbing, in terms of like, you know what I mean, if they're injured or not, and especially the elite athletes, they really want to compete all of the time. So yeah, in terms of working with the coaches, I think it's that relationship is absolutely vital, to be honest, because you've got to look, as a physiotherapist, you're looking at the short-term management of an injury, but you're also looking at the best thing that you can do as a physical therapist is not be very busy. What I mean by that is you want to not have injuries, prevent injuries, and really it's the approach of the coaches, because the coaches are setting the training program and the coaches are telling the athletes what they should do and not do. So yeah, from my point of view, the relationship with the coach is absolutely vital. It's the most important thing. And then the trust between the coach and the medical team and the athlete, that is extremely vital as well. So you're all kind of on board. So yeah, that's my perspective on that.
Yeah, and I would certainly agree is that, you know, I think luckily for us, there's definitely like high respect from my side and Josh's side for me. And that I think a lot of my training working with coaches comes from when I worked at Stanford University, and we worked with, 36 different teams. And so there was this constant communication that needed to happen. It was one of those jobs like you could not answer an email or a phone call, whether it was like 8 or 9 o'clock at night, because the decision making needed to be, you know, sometimes was urgent and things like that. So so having clear communication and you know, almost over communicating with the coach is better than under communicating, of course. And I think the other thing is, like James said, you can have pushback from coaches and athletes, and I think you just got to be confident and you have your specialty of knowledge that they don't have. And so here's a couple examples. Is we had an athlete this year who had an elbow injury, and the physician you know, wanted to wait longer to give this person the best time to heal without surgery. But would allow her to do certain exercises like pull-ups and rowing and those things. And we know from a climbing standpoint, because of diversity of movement, pull-ups is not climbing, right? It's part of climbing. So in this case, it was kind of like the coach wondered why, you know, in a frustrated manner, why they couldn't start climbing. And then you have to explain, you know, to them the biomechanics, right? In this case of this person's injury. In other cases, like you can be like less conservative. And, you know, we had a case where we had someone have a concussion this year, which is not, you don't see that in climbing too much. So I would advise you guys to really get to know your SCAT5 screens and all those things. But in this case, like, you know, the person didn't have any of the red flags you would see with a concussion. So therefore you don't need to rush them to the ER. You would certainly monitor them. But in this case, you know, the coach is saying, or the team manager is saying, let's rush her to the hospital. Well, you're the expert. And you say, okay, well, they're not meeting these criteria for that. So in this case, we do the screen and then we kind of go from there. So I think like, just realize like you're the expert in this, from the medical side for your team. And so you just have to be the advocate, obviously, for the athlete. And you know, sometimes it can be intimidating when you're like, I remember one football coach he was kind of known to be a little out there. So you just had to, kind of stand your ground sometimes. So.
I think as a final question, as we kind of come to wrap this up, and we had a lot of questions submitted, so hopefully we're able to, through the discussion, kind of hit on different parts. But if someone's looking to work with climbers and then, specifically, work with maybe a climbing national team or even a team setting, even if that's just, in a climbing gym. And this kind of feeds into also Nicholas's question they dropped in the chat too. And Zach, I know you touched on this a little bit earlier about the SCS being helpful and so forth, but what do you recommend if someone wants to get into a position where you're at now? And that can be recommendations from techniques that they should learn, education, a certain path, promoting, marketing, all those types of things. What do you think? Like, what would someone need to be able to be where you are at now, other than anything that you'd recommend? So yeah, maybe James, if you wanted to start, and then Zach as well. And I think it's important to know too, the components that James and Zach may mention may be different based on licensing and GB versus US and so forth, or they may be exactly the same. But either way, if each of you kind of want to share what you think would be helpful.
Yeah, sure. So I guess the most obvious thing to say is just get a really good knowledge. Well, just from my point of view, get a really good knowledge base and specialize in treating climbers and climbers' injuries. I actually got approached by GB Climbing rather than the other way around. I was kind of established, and because unlike Zach, who works with US Climbing full time, I don't. I have a full time normal job in a private practice in the UK, and I've set myself up so I pretty much treat climbers, not the elite level climbers on the GB. Well, I do treat them as well, but my normal day-to-day caseload is regular climbers. And yeah, I guess what I'm trying to say is I spent many years like building my sort of base in treating climbers and building that up. And for example, learning how to do diagnostic ultrasound scanning and things like that, because basically not many people know about climbing injuries in most countries. They're very unique, and certainly not many people know about climbing injuries, but then also understand climbing, understand climbers. Do you know what I mean? Like there might be some kind of I don't know, hand surgeon who really understands fingers and finger injuries, but they understand the anatomy, the language of climbing, even just talking about different grip types, what kind of things that they put themselves through, the amount of training that they have to do, the competition schedule, so actually just immersing yourself in climbing knowledge, being able to treat climbers regularly, and just spending lots and lots of time on PubMed, going through all research articles and reading all of those and keeping up to date with knowledge. It's a real kind of passion thing. We were chatting before that it's not like it looks quite glamorous. You're going around these different places in the world and to go into sort of exotic places, but for example, you don't get paid like huge amounts of money for going on these trips, like at all. It's not even great pay, but I don't really think that kind of matters too much, because it's about the experiences, I suppose. And yeah, I think sometimes it seems like, how on earth do I get into being within a national federation and being a physio? And it kind of seems a long way away. But I think I think me and Zach's no different. We just started and built things up. And going forward, climbing is just, in my opinion, climbing is just getting started. It's only just been in the Olympics. It's in the next 2 Olympics. It'll probably keep going. And it'll be more professional, there'll be more funding, and they will need more medical providers. I know lots of physical therapists and in other GB sports, and the money involved in those sports is huge. The medical teams are huge. They have 4, 5, 6 physical therapists all the time working for them. Sports like, I don't know, boxing or swimming or things like that. And there's not really any reason from my point of view why kind of climbing can't build and build. So the guys that are on this call, like at the moment, there's not many physical therapists and physios who are kind of involved in it on a global scale, but I think that will become more and more. So yeah, I guess really just kind of starting those points and building it up is the best way.
Yeah, and just echo James, I think hands down, first thing is get to know what you're going to be working with in terms of the injuries within the sport. And I can say that about any kind of sport or national team or your sport team that you might be working with. You got to know what you're going to be dealing with the most, and learn the mechanisms of injury. And then climbing is getting better and better in terms of climbing medicine. But I mean, when I started, it was hard pressed to find a research article about anything. And now, like, you go on PubMed and it's like, wow, there's things about climbing being used as like some kind of therapy, like psychotherapy, So the evidence is growing and growing, and that's why we see protocols being more and more developed. So, and then in terms of like skills, I think a lot of people don't realize, like, if you're working with a sports team, you got to kind of be prepared for it all. And I mean, I'll be honest, like, I rarely see pulley injuries during a competition, at least like for our team. Definitely have seen more knee injuries this year and a few elbow injuries. So a lot of like hamstring strains, those kind of things. So that makes you start to think about what you'd want to put into an injury prevention program in the off season, the preseason. But also, like, getting certain certifications, like the SCS, the sports clinical specialist certification, which if those who don't know about that process and what that is, it basically, you have to have so many hours of practice in sports physical therapy, and then you also have to do so many hours of medical coverage, event coverage, and that's great experience just to be there in the event something emergent happens. So you have to be ready for those acute situations. Like I said, the concussion, like, you would never think that would happen, right? But it happened, and luckily, like, those were things I had reviewed and also learned from other sports, like football. So, but I think the SCS offers, even just studying for it, and let's say you don't pass the exam, but you still learn a lot of like on the field medical management that you wouldn't get in like your typical PT curriculum. So I would advise people to seek that out. And you can sometimes do things like a residency or some kind of fellowship program. And sometimes they have sort of within that program, studying for the SCS, they'll have study groups and ways to prepare for the examination. In addition to that, I think hands-on skills, manual skills is important. I think that's about 80% of what I do on the road. Luckily, it's not hopefully a lot of actual rehabilitation, but it's a lot of hands-on that both help prevent injury, but also for recovery, things like that. So just remember, I think like it's really valued that you know a lot about climbing in general, because you will win the athlete's trust if you can relate. Like, a good example is like if someone has medial epicondylitis and you say, well, you don't want to be doing moves that are like compression moves, or you don't want to grab onto those kind of holds in this certain way. And this is how you would want to progress back to those kind of movements and holds. And they know you're speaking their language, and then it makes sense for them. So I think really doing a lot of video review, studying the movements is really valuable, helping you kind of like build those relationships with the climbers.
So I'm going to drop in chat just in closing, and we'll start with James and then go to Zach. But in the chat, we have James's information, the webpage, Instagram, etc. And he also teaches a course on diagnostic ultrasound for climbing injuries. So if anyone has an interest in that, there is a link in the chat with that as well to sign up for. But James, any kind of closing thoughts, final words that you want to give?
Yeah, well, I guess just following on from what Zack just said then, I mean, obviously, I guess the people who are in this chat are kind of, a lot of them are climbers or really interested in climbing. And yeah, it's a really good thing to do. It's like a really rewarding kind of thing, like going to these events and being with the team, especially when they win, which often happens to Zack pretty much every week. But it's really cool, and you build relationships with these guys, which is much more than just a kind of, you're there as someone who works for the team and there to do a job. You are there as part of the team for sure, and you're kind of friends with these guys, and you know, you're as passionate about climbing as they are, and certain things like that. So I guess, yeah, the thing to say is, and really going forward, I think we need to kind of need people who are going to be understanding about this stuff and interested in it. So I guess, yeah, from my point of view, whoever's kind of watching this and kind of interested in it, it'd just be great to kind of run with it and get more people interested and push the knowledge of climbing and climbing injuries, and things like that, really. So yeah, that'd be it.
And then I'm going to drop Zack's information in here, his contact information through Instagram and LinkedIn, as well as supporting USA Climbing, since if you are USA based, that is, I almost see that as an obligation to support our national and governing body. But you'll have some links there for membership and be able to donate for USA Climbing as well, to contribute back to our sport. But Zack, any closing words do you have for this as well?
I mean, I would say, like, for the aspiring climbing, PTs out there, physiotherapists, I think one thing is, I get this question a lot, and I always kind of feel bad because I, kind of start the answer with something that might be discouraging, is that I think because the sport is in sort of, and especially when it comes to the opportunities to work as like a PT within the sport, and especially with like the national team, that's still in its infancy. I mean, I've only been with the group maybe like full-time 2 years. And so I think it will continue to grow, like James said, with hopefully more sort of popularity of, whether it's through the Olympics and how the sport grows in that way. But I feel like, shooting for the stars right away, like working with the national team, might be a little, not out of reach, of course, but I just think like, don't undervalue the what you can gain from working with your everyday climber and your recreational climbers, because to be honest, I learned much more working with them, because unfortunately I saw much more injuries in the recreational climber, and just, the sheer numbers, and it just makes you really good at your evaluations and your treatment plans and your protocols. And I would say, if you want to pursue the route of becoming a national team PT, like volunteering your time at certain events, like it could be youth events. We got a ton of those out there, and we're always looking for, I think one thing we want to push for is medical coverage at those events, because I think that should become a standard. And so we have like all these youth events that happen every year. And then of course we all have national events too, where we might be a little more selective who gets to cover those events. But that's partly how I started too, is like I would volunteer my time at these events. And I think when you get kind of, at least with our organization, you kind of gain their confidence when they see that, because they know we are a nonprofit. USA Climbing is a nonprofit, so we're not like rolling in the dough or anything like that. And so so they see, like, if you're willing to put in that kind of work, and just be patient with that, like, I think the opportunities will come in the future as the sport grows. So
well, thank you both, James and Zack, for coming on and sharing your experiences. This is recorded, so it's be available to see as well. But hopefully everyone here learned a little bit, and thank everyone. Thank you everyone for coming out, and thank you both James and Zack for sharing your knowledge.